Hello, this presentation is titled Improving EMS for Children Survey Responses Among Pennsylvania EMS Agencies. My name is Duane Spencer and I am the EMS for Children Program Manager in Pennsylvania. The EMSC program is part of the Pennsylvania Emergency Health Services Council, whose core mission is to serve as an independent advisory body to the Pennsylvania Department of Health and all other appropriate agencies on matters pertaining to EMS. The 2020 EMS for Children survey began just a few days after I began my new position. The survey used contact data and an agency list available from previous year's surveys. Several weeks into the 2020 survey, it was apparent that our response numbers were low. Efforts to improve the response rate included repeated emails and calls to agencies. However, that was all interrupted by the developing pandemic and its impact on Pennsylvania, causing a refocus of efforts away from the survey. The 2020 survey concluded with just over a 20% response rate. Pennsylvania is comprised of over 1,200 licensed EMS agencies who provide emergent, non-emergent, transporting, and non-transporting EMS using a mix of volunteer and paid staff throughout the Commonwealth. Of these, nearly 1,000 are part of a 911 response, either as a primary transporting agency or a supplemental non-transporting service. These agencies are licensed through the Pennsylvania Department of Health Bureau of EMS and are required to go through a relicensure effort every 3 years, which includes submitting an online application with information about the agency. Pennsylvania does not differentiate licensure between 911 and non-911 agencies like some other states do. However, a question was recently added to the online application asking if the agency responds to 911 calls. Once the 3-year licensure cycle is complete statewide, this response will help to confirm agency placement in the contact list management system. Since the question is new, the determination of whether a service is part of the 911 response system was left up to the EMSC program with assistance from the Bureau of EMS and regional EMS councils. Pennsylvania saw a significant number of agency closures, mergers, and primary staff changes during 2020. Keeping up with these agency changes is not tracked live in any single data repository. In preparing for the 2021 survey, the Pennsylvania EMS for Children program worked closely with the Bureau of EMS and Pennsylvania's 13 regional EMS councils to identify agencies who had closed, merged, and who were not part of the 911 system in order to update the current contact list management system. NEDARC also added the option for a bulk upload prior to the survey, which helped to streamline the effort by eliminating the need to access hundreds of individual claims records. While updating agency information, the Pennsylvania EMS for Children program identified a significant barrier to survey participation. Agency representatives offered feedback on the additional workload survey participation would create within an already stressed system. Agency staffing challenges related to the pandemic, salary, and an aging workforce were key contributors. However, a significant call volume drop during the pandemic created a financial stress on the stability of many Pennsylvania EMS agencies whose size and function do not support such an impact on their bottom line. The Pennsylvania EMS for Children program recognized these challenges and worked to find ways to streamline this and other processes to reduce workload while maintaining pediatric preparedness and response during calls for service. The 2021 survey prep included a focused effort on gathering quality contact information for the nearly 1,000 911 EMS agencies. This was accomplished by merging the current CLEMS EMS agency list with the state licensure database, along with the 911 status of each agency. Clarity on 911 participation was determined through the regional EMS councils. However, with several regions being responsible for multiple counties and an agency list containing upwards of 200, this effort was met with some difficulty. The engagement of Pennsylvania's EMS regions not only helped with sharing effort, but also validated our information. These regions are responsible for supporting EMS agencies at a more direct level than the statewide EMS for Children program and the Bureau of EMS can manage individually. During the 2021 survey, results began to slowly develop over the first 3 weeks. A focused email effort by the Pennsylvania EMS for Children program in late January saw a significant jump, followed by the planned NEDARC reminder in early February and a similar increase. Further focused reminders sent out to non-participating agencies with contact information refined through a continued collaborative effort between the EMSC program and regional councils saw an ongoing increase in response over the next 4 weeks, with a final last call email barrage just prior to survey closing. The most obvious result of the 2021 survey was the significant improvement in response rate of 47.2% for Pennsylvania 911 EMS agencies. Knowing that this number includes many small, all-volunteer, basic life support, and quick response non-transporting agencies is key to realize the impact of our effort. The results are included a reduction of overall number of agencies included in the survey based on the validation effort completed both pre-survey and during survey participation. The hidden win for Pennsylvania was a collaborative effort accomplished between statewide and regional agencies in order to deliver the effective results. Initial data exchange between the Bureau of EMS and the Pennsylvania EMS for Children program created a master list, which was then refined with input from the regional EMS councils. During the survey, non-respondent lists were reviewed and refined for contacts and 911 status, along with several regions taking on the challenge and communicating directly with agencies to increase participation. Although the response rate was below that expected nationally, the significant increase over the prior year represents a strong collaborative effort with regular, clear communications between stakeholders and EMS agencies. We hope to use these lessons learned as a building block for future EMS for Children surveys, knowing that the effort for 2021 is not final and requires regular maintenance and a review at state and regional levels.